There isn't just one way to look for signs of HIV. Scientists have developed several types of tests, each with its own method. These tests search for different clues left by the virus. The most common types are antibody tests. When HIV enters your body, your immune system responds. It produces specific proteins called antibodies to fight the virus. Antibody tests look for these specific HIV antibodies in your blood or oral fluid. Another important category is antigen antibody tests. These tests search for both HIV antibodies and antigens. In the case of HIV, a specific protein called P24 antigen is produced even before antibodies develop. Then there are nucleic acid tests, or NATs. These tests look directly for the virus's genetic material, its RNA. The choice of test often depends on various factors, including the window period. Embarking on an HIV test is a straightforward journey. It begins with a decision to seek knowledge. You can get tested in many places. These include doctors' offices, health clinics, hospitals, and dedicated testing centers. Some areas even offer mobile testing units or self-testing kits. The first step is usually pre-test counseling. A healthcare provider or counselor will explain the testing process. They will discuss confidentiality and answer any questions you might have. The actual sample collection is simple and quick. For most rapid tests and some lab tests, it involves a finger prick to get a small blood sample. Sometimes a blood sample is drawn from a vein in your arm. Oral fluid tests use a swab to collect a sample from the inside of your cheek. The sample is then either tested on-site for rapid results or sent to a laboratory for analysis. Waiting for the results can sometimes cause anxiety. If it's a rapid test, you might receive your results within 20 to 30 minutes. For laboratory tests, the wait might be a few days to a week. Once the results are ready, you will receive post-test counseling. Section 5. Cosmic Messages, Decoding Your HIV Test Results. Receiving your HIV test result is like intercepting a message from your inner cosmos. A negative result means that the test did not find any signs of HIV infection. If you took an antibody test, it means no HIV antibodies were detected. If you took an antigen antibody test or a NAT, it means no viral material or specific antigens were found. This is generally good news. However, it's important to consider the window period. If the test was taken too soon after a potential exposure, it might not be accurate. If your test result is negative, but you've had a recent potential exposure, your healthcare provider might recommend retesting later. A negative result is also an opportunity to reinforce prevention strategies. A positive result means that the test detected HIV antibodies, antigens, or genetic material. This indicates an HIV infection. Initial positive results from rapid tests or some antibody tests are usually followed by a confirmatory test. This second test ensures the initial result was accurate. The news of a positive result can be overwhelming, a sudden shift in your personal universe. But a positive result is not a death sentence, not anymore. It means you can start treatment.